Welcome to The Whole View. I'm Stacy Toth of Real Everything, and I'm here each week to dive deeper into how we can find happiness and health inside and out through self love, body positivity, and discovering new ways to be our best selves. Before we get started, a reminder this podcast is for general educational purposes and is not intended to diagnose, advise, or treat any physical or mental illness. And we always recommend that you see a licensed health professional accordingly. In fact, today we're going to be talking all about seeing medical health professionals. And we have Susan Salenger here, who wrote the book Sidelined: How Women Manage and Mismanage Their Health. And one of the things that Susan, you're such an advocate for is for women specifically to seek out medical health professionals in a way that is conducive and beneficial to them. So we'll talk more about that. I know that I myself, a lot of listeners have avoidance tendencies sometimes, and that we think that Dr. Google is our best friend. And
Right.
so I think a lot of the work that you do in educating and empowering women will be really helpful. So, listeners, if you're not familiar with Susan's work, she's the author and researcher behind Sidelined, as I said, which examines the many ways in which some women manage and sometimes mismanage their health care. Susan explores how women, typically the medical gatekeepers for their families, tend to be extremely conscientious about taking care of themselves, yet at the same time inadvertently undermine their care. Born and raised in Los Angeles, Susan is a graduate from UCLA. We are both English majors, by the way, doing very different things. And after graduation, worked alongside her husband, Fred, for 25 years at their production company, Salenger Films, which produced corporate training and development, distributed worldwide. And today, at age 80, Susan lives in Northern California. So, Susan, welcome. You're thriving. You've got your own second, third, fourth career going here. Can you tell us how this came to be a passion for you?
Well, when I retired, my husband and I sold our business many years ago, and I retired for, 3, 4 seconds. That didn't work for me at all. So I went back to school and took some anthropology classes. And in those classes, I learned all kinds of information about women in medicine that I didn't know and that is not available to the general public. Academics write for each other, and I didn't quite realize that. So I thought to myself, I want to write a book. I want to share what I've learned with women, and I want to do some more research to find out even more stuff. And so that's really how it came about. I was surprised to learn just how many things I didn't know. That really surprised me.
I was just talking to my mother in law Mother's Day, who I know it's such a weird thing, but we went to college together. She went at the same time as my husband, and we actually had classes together. And so
That's so
I
funny.
have a great relationship with her. And anyway, so we were talking about our experience and different classes we took that we loved or didn't take. And she was a very conscientious student. I was not, all that kind of stuff. And I said, I remember taking an anthropology class and loving it. Like it was required I have a cultural criticism concentration in English, and I
Oh,
have a minor in women's studies, and anthropology was required for both. So my English major is specific to writing and learning about cultural criticism, which is not far from what I do today. But
yeah.
it's just fascinating that anthropology was a click for you because I remember saying how much I loved it and then being like, and then what am I going to do for a career?
That's exactly what happened to me. I went back with the intention of maybe getting a doctorate. I didn't know. And then I thought, what am I going to do with it? I didn't
Yeah.
want to teach. And I had exactly the same
Yeah.
experience.
So maybe listeners, if you're looking for something to do and be inspired and fill your time in a productive way, go
Right.
audit a class at the College of Anthropology because I loved it. Susan loved it.
Absolutely.
Yeah.
Absolutely.
Well, I will say, I know that oftentimes what inspires us are personal experiences that we've had, right? So if you took anthropology and what really stood out to you was things that you didn't know about medicine, women in medicine, was it relating to some personal experiences that you've had, or what was kind of the thing that really caught your attention about picking that as the passion as you moved forward?
Well, actually, it did come from a personal experience. That's an interesting question. Many years ago, I mean, 30, 40, whatever years ago, I agreed to have some exploratory surgery that I was sure I didn't need. I had been on medication for osteoporosis, and the doctor said, "Hey, look, I've got this new medication. It's better for osteoporosis. Let's try it." And so I said, "Sure, no problem." So I tried it. I began to try it, and I started some vaginal bleeding. And so at that point, I said, "Hey, we better go back on the original medication. This obviously I'm having a side effect." And it was not obvious to him at all. And he did a bunch of tests and he said, "I really needed exploratory surgery." I knew he was looking for ovarian cancer because that's what one of the major symptoms is. And so at that point, of course, I got scared, although I pushed back a little, but he insisted. And, I thought, well, he's a professional. So I agreed to have the surgery. In fact, I insisted it be done sooner rather than later. And of course, there was nothing there. And I went back on the old medication and everything was fine. But I thought to myself, why did I agree to this? I mean, I had options. I could have gotten a second opinion. I could have waited a couple of weeks. I wasn't going to keel over in a few days. I mean, it was fine. And on the other hand, if he'd been right, he would have saved my life. So he was scared. I was a young mother with young kids. So okay, so I was fine. And then I kind of forgot about it. Life goes on. I was working, I had the kids. And then when I took these anthropology classes, for one of them, did a project on women who had undergone hysterectomies, which actually I hadn't, but I got interested in the subject. And many of them had agreed to the surgery, even though they weren't sure they needed it. In fact, a few of them said that they were sure their symptoms were due to,
Oh,
you know,
wow.
menopausal or premenopausal, but they agreed to it anyway. So that, of course, acted as a trigger to my memory. And I thought to myself, how do women, generally speaking, how do we make our medical decisions? Why are we doing this to ourselves? What's this about? And that was kind of the catalyst for the book.
Yeah, that's really interesting. I know you talk to a lot of different women via interviews and focus groups. I'm curious, do you find that in doing that, women got better care from a male doctor or a female doctor? So, for example, we've had Mary Claire Haver, who is a female doctor who personally has gone through menopause and has become kind of an expert in the field because there aren't very many doctors who fully understand, for example, that the different kinds of symptoms that might be coming from that. It's not like it's being taught in school. And if you don't have the lived experience, then it's
Right.
difficult for someone to do proper care, right?
Right.
So, what I'm curious what you found in all these interviews and focus groups.
Actually, the women I interviewed maybe, I don't know, 50 women, 60, whatever. And the gender of their particular doctor was mixed. I did not do that research, nor did I find anything that jumped out at me. But what I can tell you is that at the time I did the research, and I did start to research whether gender made a difference in caregivers. And at the time I did the research, it was mixed. Now, the newer research seems to feel that women do better with a woman doctor. And I'm really not clear on the reasons. My doctors are both men and women. And I think that, which is fine for me anyway, too. But it does seem to be, as I said, the latest research is if you have a choice, if you're a woman, you might prefer a woman doctor.
That's interesting. I think in my personal experience, it's really about finding someone who's compassionate or empathetic, right?
Yes,
Like you could have someone who is your same gender, yet doesn't have compassion or isn't interested in exploring beyond just surface level things. Or you could have someone who is of the opposite gender, yet is interested in finding solutions and has compassion for your problems and wants to explore those in a way that's beneficial to you. So I I wonder kind of where that spectrum and research is as well, just because I think generally people say that women are more empathetic. So maybe that's why it's not necessarily like the female to female relationship, but maybe
right.
female medical professionals have, in general, more interest in, you know, that side of the medical practice, which
Well,
not everyone does.
I think that's true, but it's interesting that what you just said. I have a cardiologist that's a male, and he is just wonderful at listening to me. He spends, I go maybe once or twice a year, and he spends maybe an hour. Did you hear that? You know, really listening to me, asking me how I am, giving me a thorough checkup. I mean, he's fabulous. And I also have another doctor that I see once a year, and she couldn't care less. I mean, how are you? Fine. Great. We moved on, you know? So you're absolutely right. It depends on the particular doctor. I think that's much more important than gender.
Talked about men and women speaking to doctors different. Can you talk more about what you mean by that? And also, you mentioned like, would I have or should I have gotten a second opinion? Right? Like, do we think that women are less likely to advocate for themselves and feel empowered in an environment where we don't have control and we just shrink a little bit? Like, what do you think the difference is there?
Well, those are a bunch of huge questions. Let me pick it apart a little bit. First of all, men and women do describe their symptoms differently to doctors from each other. I mean, when men go to the doctor, for example, they're much more objective. Women we describe our feelings. We tell the doctor the whole story. And I think that there's a huge difference between the two conversation styles. And I'm as guilty as anybody. I tell how I'm feeling, not only physically, but it's depressing. I'm exhausted. I can't do this. I can't do that. And sometimes my physical symptoms can get sort of subsumed by my emotional ones. And I think that can lead the doctor to a psychological diagnosis rather than an organic one. So I think that that's something that women need to be aware of. Now, second opinions, that's a big subject. And women hesitate to get second opinions. You know, culturally, we've been taught to play nice. We've been taught not to be rude. And we don't want to hurt the doctor's feelings. After all, they're the professionals. So we really don't do. And as I told you earlier, I was very guilty of that. So I think the first thing we all need to know is that we really need to get a second opinion. But I didn't understand this, but there's about, as I said, 20 to 30,000, 40,000 diseases out there, and many of them share the same symptoms. So if you go to the doctor and you say, I'm tired, I have no appetite, I have no energy, those symptoms fit such a variety of diseases that it's really a guess. And it's a diagnosis is a personal interpretation by your particular doctor. And, we all see what we expect to see. And so the same symptoms can seem like stress to a psychologist, joint pain to a rheumatologist, stomach pain to a gastroenterologist. So that's why a second opinion is so critical, because you want to be sure that you're really getting the best or the most accurate diagnosis that you can. Nobody, including your doctor, wants to be treated for a disease they don't really have. So second opinions, I think, are very critical. And this leads me to say that in the back of my book, there's a resource section which is really helpful. I've done all your research for you, and it will tell you how to get second opinions, how to research your doctor. It will give you questions. The book gives you questions to ask so that you're sure your diagnosis is accurate. And one of the basic questions to ask when you get a diagnosis is, what else could this possibly be? So that way you have two diseases or three diseases that you can go home and research and see if you think any of them fit the particular symptoms you have.
I think it's such a great point about the same symptoms to a psychologist would be stress, anxiety, where a gastroenterologist and a rheumatologist would be treating those specific symptoms. And also the idea that when talking to a doctor, if you're talking about your stress, your depression, your lack of sleep, and they're like, oh, okay, well, you need to go on an antidepressant, also need to talk to a medical professional about treating the symptoms that we're experiencing. I've done other shows with people who we've talked about how anti-anxiety medication was a game changer for their health. And at the same time, in the meantime, those symptoms still exist, and we all deserve to
Right.
live our best life, pain free, symptom free, whatever. And maybe if we can deal with underlying stress, which is causing lack of sleep, which is causing, yada, or if it is in fact stress that's causing gastro issues, that doesn't mean that we just deal with the gastro issues.
Right.
Like we still have to focus on the symptoms, and the idea that if we're bringing emotions to it, doctors are less likely to address specific symptoms is interesting. I think the other concept that came up for me while you were talking is the idea that by and large, it's been my personal experience with medical professionals and my husband's experience with professionals that weight seems to come up a lot more for women as well. That doctors, especially with women, are quick to say all of the things that you're describing are related to weight. You need to lose weight, and then
Yeah.
dot, dot, dot. Again, not treating the symptoms. And there have been incredible, sad numbers, research on people who were overweight who did not get proper treatment and diagnosis because a doctor assumed or whatever it was about their weight. And ultimately, they had a cancer that was missed because a doctor
Right.
was, saying everything was related to their weight. Whereas, when my husband goes in, his weight is viewed differently, even if he is also in an obese category, right? Like the way that he talks about what he might be experiencing and how he receives care can often be different. Did that come up for some of the women that you were interviewing?
They did not mention that. They did mention being treated for depression. But and I think that there's 2 things I wanna say. Number 1, it's tricky for the doctor in the sense that women do suffer from depression and anxiety more than men do. So sometimes, and of course, as you said, stress can cause or anxiety can cause physical symptoms, but it isn't necessarily that the doctor's blowing you off because there is some data behind that diagnosis. But when you get a diagnosis like that, and whether it's true or not is only something that you can decide, and I think that's really hard as a patient to do, because of course you're depressed, you're feeling like crap, or you wouldn't be at the doctor in the first place. But, so it's a hard call for everybody. But that's when you have to ask that question, what else could it possibly be? That gives you something to hang your hat on. So when you go to Doctor Google, who I would be hesitant to trust, I would trust all of the mostly all of the resources in my book. I say mostly because at this point, maybe websites change. I don't know. They were accurate when I printed them, so to speak. But I think you have to be careful when you do go to Google. But by the same token, there's also some really good information out there, obviously. But if you're not sure that it's depression, and if you think that you have symptoms that also need to be treated, or if you take the antidepressant and you find that you're maybe less depressed, but your stomach still hurts, that's when I would go do my own research, get second opinions, etc. I wouldn't just say, "Oh well, I'm hopeless. I can't be treated." And that I think that happens a lot.
Yeah, I think also it's hard. My, my personal experience is you never want to insult someone, right?
Right.
And if their profession is a medical doctor and one asks for or suggests that they want or need a second opinion, it might feel like you are insulting your doctor. And sometimes, whether that's coming from a place of care and compassion for your doctor, or whether it's coming from a place of fear that you'll be ostracized the next time you come in if you went and got a second opinion, I think we need to remember that we ourselves are as deserving of the quality of care that we want to give to somebody else. If we want them, to have compassion and not have their feelings hurt, we deserve care as well. And there's a way to respectfully have that conversation. I recently had this conversation with a medical professional regarding a child of mine. And we were sure that they had specifically thyroid issues. And we saw, we had to get a referral for a pediatric thyroid doctor, which took like 5 months, took
Oh,
forever.
she
And then that pediatric doctor was very quick and very dismissive and not compassionate. And I was like, I did not wait 5 months for this person to just like be so dismissive. And because it was a specialist that I wouldn't have to see again, I didn't even really talk to them about it. I
right,
just went
right.
back to, my main provider and said, that wasn't a good fit. And it took 5 months to get in. Can you help me find somebody else that, you know, could potentially be helpful? And they got us in with a different doctor within 2 weeks. And
Uh,
that doctor was night and day in terms of the level of, like you said, asking detailed questions, looking at different aspects of their health beyond just like the surface level test results. And we found what the problem was. It wasn't a thyroid, but that doctor took the time to find what the problem was, that it ended up being a very significant problem. And if I had not gone and gotten a second opinion for this child, it would have only compounded over time how badly this problem was affecting their health. And so I hope that story kind of inspires people that sometimes it's not even about like the person itself and whether they're dismissive or compassionate. It might be that the area of expertise isn't there. So in this case, the particular, thyroid endocrine doctor that we were seeing was like, "Nope, there's not a thyroid or an endocrine problem," which was not incorrect. But they didn't use the information that they had, the tests,
right,
to dig in a little bit deeper to be able to say, "But this is a problem. Let's talk about this and try
right.
to find the problem." So, I think sometimes it's also just about finding someone who has the expertise or the experience that might be a better fit for what someone's problem might be. Does that make sense? Did that come
And
up in your
yes, and
research?
well, and you handled it so beautifully. I mean, truly. And I think another way to look at second opinions is, how do I say this? Many of the women I talked with, which is what you just said too, view it as a challenge or as you said, an insult. I don't think of it that way now that I've done the research I did originally, But really what it is you want to confirm your doctor's opinion. You're not challenging it. And I'm not suggesting you go for a second opinion if he tells you to take 2 aspirin, of course not. But if it's serious, if I had a second opinion, I would not have had surgery. If some of the women I interviewed had a second opinion, they would have not have had the hysterectomy. So I think first of all, that's important to recognize that it isn't necessarily a challenge. If your doctor interprets it that way, it may be time to get a different doctor. The other thing that I also realized, and, I've been on many of these podcasts, and I mean, have had doctors who have interviewed me, and every one of them has said they welcome second opinions. Apparently, 1 in 3 doctors can expect to be sued at least once during their career. So not only do they like a second opinion because they want to make sure they're doing prescribing the right treatment, but it acts as backup in case of a lawsuit. So I would be surprised if a doctor really hesitated to help you get a second opinion. The other problem is, and I think that all second opinion should be discussed with your primary physician, but you also want somebody with a different point of view. I mean, as I think I even say in the book, if your doctor was trained at UCLA, you want your second opinion, you want him to, or her trained from New York. I mean, you want to mix it up. Going to somebody in the same office is not necessarily helpful. So you have to be careful about that.
And I found that the best doctors collaborate with other people, either in
Right.
their office or outside
Exactly.
of their office, and are willing to say, you know what, this is not something I've experienced before. I want to talk to my colleague who has. Like, if you hear those kinds of things from your doctor, it's reassuring to me to know that they're doing everything that they can in my
Exactly.
best interest versus protecting their own ego. And if that's
Yeah,
what we're doing, then that's not, like you said, really the doctor I want to see.
right.
I think a lot of my listeners, well, actually, I know a lot of my listeners, which are all mostly women. We always joke that there's like 8 male listeners. We have more than that. And kudos to all of the masculine identifying listeners who often tune in for these topics so that they can be their best selves for the women in their lives. But I know for so many of my women listeners that they are proactive when it comes to their health. I mean, they're listening to the show. If they're listening to the show, they're
Yep, right,
obviously focusing on their health,
right,
right? And
absolutely.
so they're working at something already so diligently and having it be a part of their life. Why do you think that they would have trouble getting that most effective care? And why would women some of the time do themselves such a disservice by just kind of accepting that trouble if you
I think
with the
a
most
couple of
effective care.
Take a couple of reasons. Number one, we're so good at putting ourselves last, putting our health care last. Women women just they were some researchers gave women a list of 5 things, to prioritize. What would they take care of first? And first, they take care of their children, and secondly, their pets. I loved that piece of it. Third, they take care of elderly parents. Fourth, their significant others. And last was themselves. And that translates into we hesitate to go to the doctor. We're busy. We have projects at work. We have lunches to make, whatever. We have children to take care of. And so we put ourselves last. And I think that by the time we get there, it's so difficult to then say, well, now I need another opinion. I'm going to have to go and get to a second doctor, maybe a third. I don't know. So I think that's part of it. Secondly, I think our history is my favorite chapter in the book, but we've had such an unpleasant relationship with medicine throughout history. Women's bodies have been devalued, demeaned, whatever the word is. And it's universal, it transcends cultures. The Chinese called daughters maggots in the rice. The Dutch considered a house full of daughters was like a cellar full of sour beer. I mean, nobody loves us. It's just amazing. And I think that has been true throughout history in one form or another. And I think that many of us have internalized that and accepted the fact that we are hysterical. Remember hysteria during the Victorian age.
I
Uh,
was just thinking about that. Yeah.
well, I'll tell you something interesting. Let me just give you a sidebar for a minute. Researchers did a study where they had a group of doctors and they gave them 2 scenarios about 2 patients. Everything in the scenarios was identical. I mean, they had the same cardiac symptoms, they had the same risk factors for cardiac disease. Everything was simple. One of the scenarios did not mention stress. And of course, the men and women got the same treatment prescription for a cardiac workup. As soon as stress was mentioned, the men and women received, oh, I think the women, only 15% of the women received a prescription for a cardiac workup. So as soon as stress was mentioned, hysteria came right back into our, whatever, into our world. And everybody, and the symptoms were identical, except for that one word. So I think that
Yeah.
hysteria is still with us. And I think that we have to be careful about that.
Yeah,
But
that's
anyway, I
such a good
do
point.
think that's why one of the reasons that we do ourselves a disservice. The other thing I found, and this really surprised me, is the amount of shame that women feel about being ill. And that I was shocked. And that again translates. So many of the, let me put it this way. So many of the women blamed their illness on stress. They felt that they were overstressed and they couldn't manage their lives. And that's why they got sick. In fact, they felt that their illness was actually a public acknowledgement of their inability to take care of themselves and their families. And so they hesitated to go to the doctor. They were embarrassed. And I feel I don't personally feel that way when I'm sick, but I certainly can understand it, and I wouldn't wanna make the appointment either. So when a doctor says, "Well, yes, you are stressed," and gives you an antidepressant, that feeds right into the shame that you're already feeling in the first place. So it's kind of a double whammy. Did that kind of answer your question?
Yeah, absolutely. And I think it brought up, additional just, passions and concerns of mine. So when you were talking about the idea that there's this implicit bias, right? This
Mhm.
idea of implied hysteria in women,
Uh-huh.
whether it's being thought consciously, unconsciously. This implicit bias that comes also refers to, like I was mentioning, fat phobia from doctors,
Right.
but it's been shown by research. I know there was a study through Harvard back in the late 2000, I think it was like 2018. I'll put a link in the show notes for listeners that showed that implicit bias creates discrimination and causes harm specifically to Black women more than any other people
Yes.
in the medical profession, and that oftentimes their symptoms are believed to be exaggerated or not believed. We see more harm come to them from birth, for example, right?
Right.
Because there is, even if we remove all the other factors like where they might be giving birth or the quality of care and all these kinds of things, there's still higher harm factor, and that implicit bias is important for all of us to be aware of when we're seeking care, right? Like if we're not aware that our doctor might be biased and thinking that we're hysterical about our cardiac symptoms, or that, they're not giving us the proper care because we're a woman of color, then it's not going to, well, not we, obviously, I'm not a woman of color, but I mean, as part of a community, if we're not part of awareness with that implicit bias, then how can we possibly advocate for ourselves around it? Like the education is so important for people to bring that
Let me tell
up.
you a story about that because just a personal story, but it's true as far as ageism is concerned as well. When my mom was about 75, she just went in for some outpatient knee surgery. It wasn't even a knee replacement. I forgot what it was, but it was no big deal. So she was fine. My mother did not have a senile bone in her body. She was still wearing high heels. I mean, she was amazing. Anyway, so they gave her some pain medication and she came home. And within about 48 hours, maybe even 24, she could barely remember her name. She didn't know who was the president, all of those things. It was like instant senility. So, of course, we rushed her back to the doctor. And both my dad and I said, what's going on here? And the doctor actually, and he was a family doctor, he's been our doctor for years. And he pulled me aside and he said, Sue, you have to let your parents age graciously. You're making them feel bad and they're getting older. And I said, but Steve, that can't be. You don't, I mean, you may be right, but you don't get senile overnight. You don't go in one day sharp as a tack and the next day you can't even spell your name. I mean, really? And he was absolutely adamant. And so we just went home and threw out the pills and she recovered. She was allergic to something in the medication. But if we hadn't been so aware, and if we hadn't thrown out the pills, I mean, gosh knows, God knows what would have happened. It would have been a downhill slope. So, like you said, you really have to be aware. And if it doesn't feel right, then it probably isn't. That's really go with your gut. I knew that damn surgery of mine didn't feel right, and I never should have had it. I mean, there was, again, no big deal. I was lucky. But think about the risks. I mean, I went into the hospital, and hospitals are notorious for germs. I was given a general anesthetic. I mean, it's risky. I was an idiot, truly.
We're not, you are not, right? I think it's a story that we can all tell. I've heard it countless times with birth stories of women feeling like they weren't educated about their own rights or options and being talked into, things that they really weren't comfortable with. I know for myself, I had a birth story that, I wish I could go back in time and change, even though my children are here, they're happy, they're healthy, I'm okay, we're all gonna move
Right,
forward from
right.
it. That doesn't mean that I don't want to educate people behind me to not make the same mistake. So don't I say this all the time. I'm like, "Susan, you're my friend now. You can't talk about my friend like that. She's not an idiot.
Thank
She's
you. I appreciate that.
supposed to talk like her mom."
No,
I
but
know
you're right.
we're sharing a lot of our own stories. I'm curious if you can tell us more about some of the women that you interviewed and the focus groups that you did. Like, what kind of people were they?
I interviewed it was interesting, actually. I interviewed all women, obviously, because it's a book on women. I did not do any research on men. I wasn't interested in the comparison. as much as I was interested in how women make decisions. So I stuck with women only. And I picked women with all different diseases. I didn't just want the same illness because I was interested in their behavior and their perception of themselves rather than the particular illness that they suffered from. And what was so fascinating about the focus groups, and I did that just to get some geographical diversity, was that none of the women, and this shocked me, none of the women had ever talked with anybody other than their doctor about their illness. They were so delighted to be in the focus group that actually it took over the focus group because they were exchanging stories. They were all so glad and so relieved to talk to other women who had similar issues, again, regardless of the particular disease. And I thought that's where the shame came in because they were all basically ashamed of being sick. They felt they had no business being sick. It interfered with their abilities and even desires to take care of their family because they didn't feel good. So I really learned a lot, particularly, well, from all of the women. But the focus group, that was a question that I hadn't asked the women I interviewed. I never said, well, who do you talk to? Who's your support? It didn't occur to me that they didn't have any. So that was really a major life lesson for me.
Yeah, I can see how powerful that would be. I am a foster parent and am in support groups for people who are going through similar situations, and it was life-changing for me in terms of my ability to be a good parent, regardless foster or not. Like, it's just finding people who are interested in, positive parenting techniques and different kinds of things. And I think like when we have young kids, we're quick to find, like, I know for me, I joined groups so that my kids could play. And those served such a purpose in a support group of moms also going through the same thing. And as we get older, it's so hard to make new adult friends, right?
Yes,
And so maybe the ones that you have don't have the particular lived experience that you have, but there are absolutely so many support groups and online communities, especially. I attend both virtual and in-person support groups because I find that I get different kinds of benefits each. But I love the idea of, one of your biggest takeaways being that people didn't have the support or the community, right? Like,
yes,
we're talking a lot about community care in so far as like lifting one another up or you're helping people find resources towards these different things and stuff like that. I think we need to be
right.
aware that if we're dependent on one single person, our doctor, with everything that we need, it's not going to encompass everything that we need. That person can only give us what their expertise or their knowledge allows.
Yeah,
And like you said, most doctors want you to have more than they want you to
yeah,
have your best care, which might be not just a second opinion, but also, other people going through what you're going through. Maybe they can tell you about some new product that they found that's going to help with symptoms or a medication that, you can talk to your doctor about, or you know what I mean, different kinds of things that might be
yeah.
helpful. Yeah.
I'm curious, what for you is the difference between online support group and meeting in person? You said that you get different things from them both. How does that work? I'm curious.
Well, I think with in-person support groups, I've been able to develop a more deep relationship because it's like the same couple of people that go
Right.
each week. And so
Yes.
I know them and their circumstances
Yeah.
really well. And we've kind of forged a relationship that way.
Okay.
But their circumstances are different than mine. So they have a younger kid, one of them. I have a teenager. Another one has what's called kinship care. So they're related to the
Mhm.
child in their care, which legally is different. So when we talk about
Uh-oh.
things like what resources do I have access to, it's very different than someone who has kinship care. And the only reason I kind of know all of those things is because then virtually, if I'm attending something, there's larger attendance because you can get, like you said, larger geographic
Right.
attendance,
Right.
but the relationship online is not as deep. So I'll find people who have similar experience than mine or, something like that. And we can talk about teenage specific things or, whatever it might be. but I'm not able to develop like a true
Got it.
connection and friendship in person.
That makes perfect sense. Do
Yeah.
you see in a virtual group, do you see the same person more than once? Do they come and go? I guess
Yeah,
it
often. Yeah, it depends, it depends on the group. I have a couple of different virtual groups and there there's oftentimes the same people. I often find also with virtual groups, and I'm sure we can all relate to this, a lot of people have their camera turned off and like it's hard to make a connection in a
yes,
support
you
group with
can.
someone that you
I
can't see
agree.
their face. Like
No, I
you don't want
agree.
to get vulnerable and like,
Yeah.
like
Oh, it's true.
yeah, yeah,
True.
yeah.
Well, and I mean, nonverbal communication, we read faces as well as or as much as we listen.
Yeah,
You know?
I think I've read before that nonverbal communication is 80%
Yeah,
communication.
sure.
So, yeah, I have such empathy for teachers who did virtual school with all those kids' cameras
Ah,
turned off, like just
yes.
talking to a black screen for a
Ah,
year.
terrible.
Yeah. Yeah.
Terrible. Absolutely.
Well, Susan, I know we've talked about so much. One of the things that I like to do with my listeners is leave them with something that's positive and actionable in terms of suggestions that they can take to be of service to themselves. What are your top 3 tips or actions that we can all take for us to better manage our health and decision making capabilities? So I know you talked about this resources in your book. Maybe you want to share a little bit more about them or other tips that you found that have come up in your research as being really important.
I do have a couple actually. I'm glad you asked. This is quite specific. I think it's very important to focus and to think about when you visit the doctor, you want to be able to control the interview or the visit a little bit. I mean, obviously, the doctor will also control it or focus it. But I think it's very important to go in with a list of your symptoms. And by list, I don't mean something in your head, I mean a written list. And I think that the list needs to be prioritized so that when you go there, you say what's on your mind. And if you're like me, you get so anxious that I forget what I came in for practically. So I always go in with a list. And I've talked with many doctors, and they said they really appreciate a list because it helps them focus the interview too. And they want to know what's really going on with the patient. So, number one, go in with a list. Number two, ask the doctor for the clinical name of your disease so that you can go home and research it. And let's talk about research just for a quick minute. That apparently, and this was a study, we take about 8 hours to research a new car. 10 hours or so we do research for a new job, and just about 0 hours for a surgery or a particular surgery or the surgeon who's going to perform it. So I think that, I think that your body, your surgery is far more important than your car. So I think that research is really important. And I think it's important to get the clinical name so you know what you're looking up. And then also, I think it's very important to reframe in your own words what you heard the doctor say. There's two reasons for that. One, it gives the doctor a chance to be sure that he or she said what they meant to say. We all misspeak. And second, it gives you a chance to make sure that you heard correctly. And it gives the doctor another opportunity to confirm or correct, if necessary, what you've heard. This is so important about saying it in your own words. Because just the other thing that blew me away, besides shame, there was one more thing. And that is that only 15% of women will tell the doctor when they don't understand something. So that means that 85% of us leave that doctor's office without fully understanding what we've been told. And so that's why I think it's so important to to re-say it in your own words. And then it's also important to take somebody with you so that you have 4 ears that are listening and or taking notes or whatever, so that you're sure that, again, that you heard everything and understand everything you need to know. And the last thing, well, really, one of the doctors said, be sure to tell women not to come up with a new problem as we're leaving the room, because that way you really don't get our full attention. And I thought that was a good point. So those are about it. That's pretty specific, but I think that those are very important. And the last thing I want to leave everybody with is to remember it's your body or your mother's. In my case, that was my mother's story. but it's your body and you really need to be in charge of it. You need to do your research. You need to clarify what you don't understand. You don't want to just go in for a treatment for something that you may or may not have, or maybe there's other options for your treatment. You want to know why your doctor arrived at the particular diagnosis they arrived at and what else it could possibly be, so that you don't just feel that you've been blown off. You want to make sure that you have choices to look up if, and maybe there isn't anything else. It may, if it's a thyroid problem, something like that is self-evident. The doctor knew it wasn't, period, you know. So again, do your research, go in prepared, and remember it's the only body you have, the only one you're going to get. So take care of it.
I love all of those, and I think the thing that came up for me when you were talking is also the idea that you are a customer. Like, you are paying for a service. And I think oftentimes we forget this, right? Like, we talked
Yes,
about how we don't want to hurt anybody's feelings, or maybe we don't understand, or we think we don't understand. And so, therefore, we don't want to be perceived a certain way. And I think it's important to remember we are hiring someone to do this service for us. And just like if someone were painting your house,
right,
and you weren't sure about the color, or you didn't like the way that they were painting your house, or you'd never seen it done that way before and you wanted to understand why they were doing it differently, you would ask questions, or you would make a change, or you would get a second opinion, or whatever it was. And I think it's easier for me when I started remembering, oh, I'm paying them, like I'm the customer, right? If you have a doctor that treats you like they don't have the time of day for you, then it's not the right doctor for you. Because I get that the medical field is completely it's messed up. I don't know how else to put it, right? Like, the
right,
fact that doctors are in school for so long, and then most of the work that they're doing when they come out is really not related to the education that they're getting. They're fighting with insurance companies.
right,
They're,
exactly.
doing all of this kind of stuff. And not able to do the thing that their passion brought them to that field to do, which is to help people. And I think the longer that they've been in it, probably the more frustrated that they get by
Mhm,
that. And
mhm,
so I know a lot of our listeners seek care from doctors who don't take insurance, or who are functional medicine doctors, because we find oftentimes that those people have the time and attention that you might not be able to
right,
get elsewhere.
right,
And so, just a reminder for people, like the story that I told, I was going through a very like systematic process of doctors. Like, I was going through, our regular physician, and they were giving me a referral to someone who worked in a hospital, right? Like, these were not alternative medicine doctors, but I still was able to find someone with that second opinion who was willing to say, while I don't see a thyroid issue, I hear what you're saying about your symptoms being problematic, and I
yeah,
want to help figure out why that might be the case. So I think it's important to know that, you're deserving of proper care. And if you're working with someone that isn't giving you a service that you like, there are alternatives. And that's harder when, you don't have the income for it, or you're in
right,
the military and you're, restricted to who you can see. And there are ways around these things. So finding a support group or doing the research on, alternatives and those kinds of things are so important. Also, be aware that doctors have like Yelp reviews. Like, you can Google a doctor,
right,
their reviews will come up. Before I see a doctor, I
sure.
100% am Googling what, like, as much as I can find out about them, because I want to go in educated. And, it helps me be a better patient if I understand where they're coming from,
Right.
have proper expectations.
Yeah, I agree with all of that. And sometimes what I also do is look to see what papers they've written, what's their specialty. That's always interesting too.
Absolutely. Yes, it's all available. I'm fascinated to hear about how few people research that stuff. And
Yes.
for sure, it wasn't something I was doing before the last couple of years, but everything is on the internet now. And so
It's
it's,
fabulous.
it's so easy. If you're even if you're in the waiting room for a doctor, go ahead and Google, like
Yeah,
I've
absolutely.
done it with my dentist. I've done it with, all these people. And, you're also able to find my hair I did it for a hairstylist, right? I was able to find the top 2022 local hairstylist place, and I'm like, "Alright, I'm gonna check them out." These people,
Yeah, sure.
their clients love them. So, it's about all the services that you're getting, make sure that you're
Yeah,
happy with them, and
right.
healthcare is just one aspect of that. So,
Yeah, absolutely, absolutely.
well, Susan, thank you so much for joining us today. Listeners, we'll be sharing what we really thought over on patreon.com/the whole view, which is the best place to ask questions too. If you love the show that we create and produce ourselves, a Patreon is a great way to support the show, but so is leaving a review in whatever app you're listening. Hit the follow and subscribe button as well so that others can find us and you'll never miss an episode. We've put a list of resources into the show notes for you at realeverything.com. Thank you for tuning in today. We appreciate your willingness to be open to growth through your own personal changes. No one is perfect, but in listening, learning, and unlearning, we can become better versions of ourselves.